Good morning, Northwest Ohio EMS Consortium. My name is Dr. Steven Zahn. Some of you may know me. Today we're going to go over how to make a push dose epi. As you recall, we used to have this in our protocols. However, due to some pharmacy issues and the concern about compounding, it was removed some time ago. So we'd like to bring it back as we think it's an important tool that you can use for times when you have a patient that is unstable who may be having acute hypotension and you're concerned that they're going to code. This is kind of a peri-code medication that you can give as a band-aid to get them to the hospital in one piece. So there are lots of ways to make this medication. Many of you are familiar with the three-way stopcock method, and there are some others as well. However, based on our practice and testing here, we've noted that there are a lot of inconsistencies, especially with the three-way stopcock, in the fact that you can have up to a 0.5 ml difference if it's not primed correctly. So we're going to try to steer away from these if possible. Another way people tend to make them is with a flush. These flushes are a great idea if they have standard graduations. However, most have a sticker on them, and if that sticker is not placed in the appropriate place from the manufacturer, you can have a little bit of error. So we're going to stick to a printed on graduated syringe in order to make this. So you're going to start by opening your epi. You can just keep the ampule. You can get rid of this syringe portion and take the cap off. Take a blunt fill needle. These come in different sizes. You want to make sure that you have one that is the longer version, not the short version. You're going to want to take your syringe and fill it up with 9 mLs from your normal saline bag. Make sure you get it right to that 9 mark. And you're going to place your blunt fill tip on to the syringe. From there, you're going to introduce the syringe needle into the epinephrine. And from there, you're going to draw off 1 ml. So you're going to start at the 9 and go to your 10 marking there. All right. So now you have your push dose epi. This is going to be 10 micrograms per ml. Recommended dosages are from 0.5 to 2 mLs, so from 5 to 20 micrograms. And this is going to be used, like I said, in those cases where you are concerned for acute precipitous drop in the blood pressure, and you're going to be giving that dosage. It should take effect within about a minute and last maybe about 10. And that's how you make a push dose epi. Just a reminder, once you have your push dose epi made, you want to ensure that this is well labeled, number one. You could have pre-made stickers to put on it, or you can have Sharpie to write it on it. And I'd recommend not setting it down alongside any syringes or flushes. This may be confused for that. Instead, I'd keep it maybe capped, put in your pocket, so if you need to redose, you can do that. Thank you.